Have you ever known someone who has contemplated suicide because of either physical, mental, or emotional health problems? Physician-assisted suicide has become a huge controversy in the United States and in the world in recent years. According to the Merriam-Webster Dictionary, the medical definition for physician-assisted suicide is suicide by a patient by means or information provided by a physician who is aware of how the patient intends to use such means or information. Many people have a very unclear understanding of what physician-assisted suicide is. Having had a close family member in a situation such as this, it has given me a great insight on the facts of the matter. People give physician-assisted suicide a better idea than what it truly is, which leads to others voting for something while being misguided. Although physician-assisted suicide is highly misunderstood, there are facts and influences that show the real cons. Clinics now have more medicine and advances to relieve suffering and pain instead of committing suicide to make the pain go away. According to the Stop Assisted Suicide website, today patients with terminal diagnosis can often live full and largely pain-free lives. When they do become more ill, they present passionate care that prevents needless suffering. There are more than many types of drugs and pain medications to be used on patients before resulting in a physician providing the patient with deadly medication. Depending on the patient's amount of pain, a few types of pain medication are NSAIDs, corticosteroids, narcotics, local anesthetics, and many more. There will always be a change that recovery can occur or a miracle can happen. If the physician agrees to provide a patient with the knowledge or means for them to commit suicide, there is always a possibility of the patient having been able to survive or recover from the illness. The patient could be making a decision based off of temporary pain or misery at the time, but it is the doctor's job to reassure the patient that they are doing everything they can to solve the problem and not give up. Not only are the chances of the patient being able to survive, but it interferes with the beliefs in the medical system along with the jobs of a doctor. Physician-assisted suicide challenges the ethics and morals of practices and beliefs that physicians are supposed to have. Many physicians, when graduating medical school, must take what is called the Hippocratic Oath. According to the Merriam-Webster Dictionary, the medical definition for the Hippocratic Oath is an oath that embodies a code of medical ethics and is usually taken by those about to begin the medical practice. Once a soon-to-be physician takes the oath towards the end of medical school, many hold a strong belief in the following ethics and beliefs of the long-existent traditional oath. According to Snyder and Solvency's medical journal, medical professional codes have long prohibited involvement in assisting a patient's suicide. Both the Hippocratic Oath and the Code of Ethics for Nurses with interpretive statements have statements in them that are equally against providing a patient with any substance or knowledge related to suicide. According to Tyson, the Hippocratic Oath states, "I will never give any deadly drug, having been asked for it, nor will I make a suggestion to this effect." Whenever a doctor may be confronted with a patient who would like to take part in physician-assisted suicide, the doctor must think back and remember the ethics that they vow to uphold and keep. It is the doctor's job to do their best in healing the patient and helping the patient recover. If the doctor chooses to help in ending the patient's life, the doctor is no longer trying and has in a sense given up on the patient. Lockman says, the American Nurses Association of Code of Ethics for Nurses with interpretive statements identify the expectation that nurses provide intentions to relieve pain and suffering of the dying patient, even if they may hasten death. However, the same passage states, nurses may not act with the sole intent of ending a patient's life, even though such action may be motivated by compassion, respect for patient autonomy, and the quality of life considerations. The Hippocratic Oath also states, "What I see or hear in the course of treatment or even outside of the treatment in regard to the life of men, I will keep to myself, holding such things shameful to be spoken about." Because of this statement made in the oath, if a patient so desires to follow through with the plan of suicide, no doctor is allowed to inform any family or friends, and the doctor will also not be present during the suicide. The vow of privacy between patient and doctor can leave families heartbroken and confused because of misunderstanding and unknown of how and when it happened. Now that some problems related to the patients and doctor are known, it is important to realize the hidden problems that can occur in the future. If physician-assisted suicide becomes legalized, many non-critical patient suicides and other abuses of the drugs can occur. If physician-assisted suicide is legalized, people will have the opportunity to abuse the medicine even if they are not in critical condition to need it. This can lead to many people who are going through a hard time only at a certain point in their life to choose to follow through with PAS, but only for a temporary problem. People who are diagnosed with an illness that may not be so severe could choose to commit physician-assisted suicide because they do not have the support they need and feel as if it would be easier than dealing with the pain. Legalizing PAS can make the drug much easier to get a hold of and could fall in the hands of a child, depressed person, or someone who thought the medication was harmless. If someone chose not to follow through with the suicide, they could have taken a dose that can leave them incredibly ill, or a dose that can provide them with a much more painful death than the medicine is supposed to give. And so, the decision of legalizing physician-assisted suicide has many more facts behind the initial belief and will not affect only the patient committing the suicide. In conclusion, the ideas behind physician-assisted suicide are much different than many believe. You do not see how it affects the doctor's ethics and morals, the ideas behind the patient's mind in wanting to end their life, possibly because of temporary pain, all the people affected when finding their family member or friend dead, and the lives it could touch in getting in the hands of the wrong person. In the words of Snyder and Swansea, legalization would undermine the patient and physician relationship and the trust necessary to sustain it, alter the medical professional's role in society, and endanger the value our society places on life, especially on the lives of the disabled, incompetent, and vulnerable individuals.